Big news. Kim Kardashian has just revealed she was diagnosed with a brain aneurysm. Here's why this matters for you. Hello, I'm Dr. Priyanka Mathur, founder and CEO of MediPocket USA, the world's first physician-led cross-border care concierge. Today, we are going deep on a condition that often flies under the radar, brain aneurysm. What it is, how it happens, what to watch for, and how advanced US care and international access can make a difference. To bring this home, Kim opened up in a teaser for the Kardashians about doctors finding a little aneurysm during the MRI scan. She attributed it to stress. This matters because it highlights how even high-profile, medically aware individuals can be confronted by a diagnosis that may have no obvious symptoms, and how early detection and expert care can open options. She also drew attention by stating, "This week has been the hardest week of my life," when discussing the news. And she's not alone. Many celebrities have battled brain aneurysm. For example, Emilia Clarke survived 2 ruptured aneurysm. The message: this isn't just a theoretical risk, it's real, and it affects all of us. So what exactly is a brain aneurysm? It's when blood vessel wall in the brain develops a weakened area that balloons outward. Think of a bulge in a hose under pressure. The medical term is intracranial aneurysm or cerebral aneurysm. If the aneurysm leaks or ruptures, it causes bleeding inside the brain, a hemorrhagic stroke, which is an emergency. But here's the key. Many aneurysms remain unruptured and may never produce symptoms. According to some data, around 1 in 50 people may have an unruptured brain aneurysm at any given time. That means you could have it and never know, which is why understanding risk factors, screening, and expert care matters. Let's break down causes and risk factors. High blood pressure. Now, increased pressure on vessel wall increases risk of bulging. Smoking. Chemicals in tobacco weakens vessel walls and increases rupture risk. Family history, genetic predisposition. Now, if someone in your family had an aneurysm or a related vascular disorder, your risk is higher. Now, very broadly, middle age and female gender are seen with a higher rates of aneurysm detection. Stress. Now, while stress alone isn't shown conclusively to cause an aneurysm, chronic stress can raise blood pressure and increase risk. Kim's doctors pointed to stress as a possible contributor. Other factors and vascular abnormalities like congenital vessel wall defect, certain vascular malformations, head trauma may play a role. Now, key facts here is that many aneurysms are found incidentally when imaging is done for other reasons. The silent nature of many aneurysms make them tricky. Also, when rupture happens, the prognosis can be serious. High mortality, high risk of permanent damage. So how do you detect one, or when should you suspect one? Signs when unruptured. Occasionally, a large aneurysm may press on nearby nerves or brain structures. Now, symptoms such as persistent headache behind the eyes, vision changes, double vision, numbness, or a drooping eyelid, but often no symptoms at all. Signs of leak or rupture aneurysm. Now, in this sudden severe headache, often described as the worst headache of my life. Nausea and vomiting, stiff neck, sensitivity to light, loss of consciousness, seizures, sudden neurological deficits. Let's talk about screening and detection tools. Now, if suspected, imaging such as CT head, CT angiography, CTA, magnetic resonance angiography, MRA, to visualize vessels. In many cases, identification happens incidentally. MRI is done for unrelated headache or imaging. Early detection of an unruptured aneurysm, especially in someone at risk, opens up more options. Bottom line is, if you have a risk factor like hypertension, smoking, family history, or unexplained symptoms like new vision changes or headaches, have a low threshold to ask for vascular imaging or specialist opinion. Prevention and proactive screening are key when a diagnosis is not yet made. Prevention measures like strictly controlling blood pressure, quitting smoking and avoiding secondhand smoke, maintaining healthy weight, engaging in cardiovascular exercise, healthy diet supporting vascular health, stress management, regular checkups, especially if you have a family history or other risk factors. Advanced screening and when to consider it. Now, in general population, routine screening for brain aneurysm is not standard unless there is a compelling risk factor like a known family history of aneurysm, prior aneurysm in patient, or certain genetic syndromes. Now, some high-risk patients should consider referrals to neurovascular specialists for evaluation, emerging technologies, and research. Flow modeling, advanced imaging, vessel wall MRI to assess aneurysm risk of rupture are under investigation. For example, one study shows new biobots and thin film flow diverters as next-gen strategies. If you had an imaging and a small aneurysm was found and you're being told to watch it, that's valid. But you should understand the monitoring schedule, risk factors, and if you should get a second opinion at a major center. Now, in the United States, at top centers, care is highly individualized and uses the latest technologies. If unruptured and low risk, often a conservative strategy like monitor and periodic imaging, control blood pressure and risk factors, lifestyle modifications. If the aneurysm is judged higher risk with the size, location, growth, shape, or if it is ruptures, open surgical clipping. Traditional brain surgery, where the neurosurgeon places a tiny clip across the base of the aneurysm via a craniotomy. Another is endovascular coiling, a minimally invasive technique where coils are placed into the aneurysm sac via catheter from the femoral or radial artery to induce thrombosis or occlusion. Others are flow diverter stents or stent-assisted coiling and other novel devices. Now, they are used for wide neck aneurysms, fusiform shapes, and complex anatomy. For example, institutions like Johns Hopkins Aneurysm Center treat complex recurrent aneurysm using both open and endovascular approaches. Centers like the Barrow Neurological Institute in Phoenix treat tens of thousands of aneurysms and offer full spectrum care. Other centers such as Beth Medical Center's Brain Aneurysm Institute in Boston provide coordinated neurovascular care. Why this matters for international or complex patients. At these centers, you get access to multidisciplinary teams, neurosurgeons, interventional neuroradiologists, intensive care, clinical trials, advanced devices. Important is what to ask or assess when evaluating options. What is the experience volume of that center in aneurysm surgery or coiling? What are the outcomes, rupture rates, reoccurrence rates, or complication rates? Is the team experienced in both open and endovascular options so choice is tailored? Ask what will your monitoring schedule look like? What is the long-term plan? Personalized approach is important because anatomy, aneurysm size, location, anterior versus posterior, circulation, patient age, comorbidities all factor into deciding best path. A one-size-fits-all strategy doesn't work. Now, here's where MediPocket comes in. If you or a loved one is anywhere in the world and a brain aneurysm has been discovered, or you are navigating risk and you want the most advanced options, here's how we help. We arrange remote second opinions from the top US neurovascular centers. Your imaging, history risk are reviewed by specialists. We coordinate cross-border logistics, travel planning, medical visas, accommodation, local liaison, interpreter if needed. We match you with the appropriate center considering aneurysm complexity, patient's comorbidities, budget, insurance, TPA needs. At MediPocket, we stay with you end to end. Pre-treatment consultation, treatment planning, follow-up monitoring, and rehabilitation. For international payers or insurers, we provide physician-led summaries, care pathway reviews, outcome forecasting, reducing risk, and uncertainty in sending patients abroad. In short, you're not navigating this alone. You're accessing the world's best brain aneurysm expertise, coordinated logistics, and care continuity designed for you. If you or someone you care for is dealing with elevated risk, has been diagnosed with a brain aneurysm, or wants a second opinion from US experts, you don't have to wait. Send me a DM or comment MediPocket and we'll schedule a brief discovery chat. Let's make sure nothing is left to chance. Thank you for watching. If you found this helpful, please like, subscribe, and share with someone who needs this. Stay well, stay informed, and stay empowered.